Hi, and welcome to the Right to Remain Silent podcast. I'm Jim Weber, your host and guide through actual accounts of intriguing and fascinating true crime stories as told by the law enforcement professional that experienced the event. The Right to Remain Silent podcast makes no exaggeration of fact, doesn't glamorize details, or sensationalize reality. The format here is basic. Real stories from real cops. Lastly, please don't forget to like, follow, subscribe, and share. Doing this will help me continue to provide you, the listener, with captivating and relevant true crime stories. Now, let's listen in on today's episode. Hi, and welcome to today's episode of the Right to Remain Silent True Crime Podcast. I'm your host, Jim Weber. Today's guest is forensic psychologist, Dr. Joni Johnston. And today we're going to be discussing serial killers and the mindset and thought processes of serial killers. So, Dr. Johnston, should I refer to you as Dr. Johnston or Joni? Which do you prefer?
Joni is absolutely fine.
All right. Well, welcome to the podcast, and I am really looking forward to this conversation.
I am as well.
All right. Outstanding. Well, I'd like to ask you, before we get into our conversation, why did you decide to pursue a career in the field of psychology and then specifically get into forensic psychology?
The first part, I think, just the psychology part of it. I kind of grew up and I was the oldest child and had a much younger sister. And I was always a pretty good listener, I think. People would tell me that. And I really enjoyed listening to my friends' problems and kind of being a big sister slash mom. And so I just had a natural interest, I think, in people, what made them tick. And my mom was an unbelievable true crime fan before we even thought of that as, as a thing.
Yeah.
And I would watch all these Ironside and Mannix, and I'm trying to think of all the old cop
Right.
shows, and
Yeah.
and so
Kojak and
I always had that interest. And then I read Helter Skelter when I was 14 about Charles Manson and the family, and that really, I think, solidified my interest in not just in psychology, but really in trying to understand why people would hurt other people that they didn't even know. That was the part of that book that I just could not get my head around. And so that really, I think, transitioned me and probably from a true crime follower, which I always would have been, to a forensic psychologist.
Okay, that is super interesting. Well, could you now there's a little bit of a difference between, straight psychology work and forensic psychology, correct?
Absolutely.
Could you kind of just give us a basic explanation of the two and what the differences might be?
Well, psychology, as you can imagine, is a pretty broad area of study. So there's people who do research, people who teach in colleges and universities. There's people who are in private practice, who I think most of us think about when we think about a psychologist. We think about a clinical psychologist, somebody who's seeing patients or clients on a regular basis. And forensic psychology is a specialty area of that. And it essentially involves looking from a psychological perspective at any area where it can help inform legal decisions. So it's kind of the intersection of law and psychology. And that of course, can be relatively broad as well. So it's everything as broad as evaluating emotional distress. For example, when somebody has a car accident and they're claiming that they have PTSD, you might have a forensic psychologist evaluate that person to say, okay, does this person have PTSD? And if they do, is it related to this injury that they had? All the way to what I do, which is criminal forensic psychology, which often involves things like evaluating defendants for violence risk, or it can be evaluating somebody who's claiming not guilty by reason of insanity, and those kinds of things. So when there's a criminal question or a legal question related to a criminal case.
Okay, that makes complete sense. And I'm just not sure that everybody today really realizes the difference. So I appreciate that. So you're actually a practicing forensic psychologist. You're a private investigator. You're a crime writer. You have quite an extensive background. You've worked in a medium maximum security prison for the Board of Parole, for the Superior Court of San Diego. And my understanding is you also conduct workplace investigator type of things with misconduct allegations. Is that right?
Yeah, as you can see, I have a broad interest in a lot of different things,
Yeah.
all
Yeah.
under the criminal forensic psychology umbrella, although sometimes the workplace stuff does kind of creep into civil kind of issues.
Sure.
But really, violence, I think, is kind of something that I specialize in, if you want to look at an umbrella. And that can be in the workplace when there's a threat or a concern about an employee, whether it's this person has a severe mental illness that's not being treated, or whether it's somebody who's disgruntled or angry and is threatening to kind of to shoot up the workplace or those kinds of things in the workplace. And then again, like you mentioned, I do a lot of work for, criminal defense attorneys, prosecutors, the superior courts, and anything that involves parole issues or violence issues or mental health issues related to violence.
Okay. And the reason that I brought that up and mentioned that is to make the point that you are directly and actively involved in this field. You're not simply sitting in a university or you're not simply sitting in an office doing, educational research. You're out there analyzing and dealing with these types of individuals that we're going to talk about today. So I think it was important to kind of mention that about what you do. Again, before we get started, I just want to thank you, and I'm looking forward to this. So, how about we just jump right in and start talking about serial killers? Is that okay?
It definitely is something
All
I
right.
talk about quite often. So
All right. Well, I think you're the go-to person for this, so let's do it. How about we start out with just a maybe a general description or a general definition of what a serial killer is. Is that a fair question?
it is, and it's one that's changed over time. So prior to 2005, for example, the definition of a serial killer was somebody who's killed at least three people in separate events. That changed in 2005. And so now the current definition is someone who has killed at least two individuals at distinct periods in time, which is, when you think about it, is incredibly broad.
Sure.
We think
It
about almost,
sounds like that.
it is. And I think most of us think about very specific individuals, or we have this kind of idea in our mind of the Ted Bundys or the John Wayne Gacy's, who, they're picking, young women, they're doing certain things to them. And that certainly is, those are serial killers, but it really is a pretty broad category. And so if anybody has killed somebody and, two more than one person over in two distinct time periods, they would meet the definition of a serial killer. So it's quite broad. It could also be, for example, somebody who's killing serial husbands for life insurance policies and they're poisoning them. We don't
Oh
tend to
yeah.
think of that person as a serial killer, but that's certainly would fall into that category.
Oh, that is a great point. I had never even thought of that. I've been in law enforcement 30 years and I didn't think of that specific scenario. So that's fantastic. Is there a difference between, say, the legal definition and maybe the psychological definition? Is that even a fair question? You know what I'm trying to say there? The law and the legal definition, and then from the perspective or standpoint of a psychologist, is there a difference?
That's kind of a tough question, only to this extent. The definition of psychology has really pretty much been FBI driven. So
Mm,
it's not really a psychological definition. It's really not a legal definition. It's just a classification. So if you go, for example, into what I guess I'll call our Bible, which is the DSM, which is where you find all the diagnoses, you're not going to find a definition of a serial killer in that. And
okay.
you might find an FBI classification that says this is how we're defining it. In 2005, I was mentioning this change. They just had this huge number of different experts. The FBI just kind of called together a lot of different experts in a lot of different fields to try to figure out what are we going to call serial killers? Who are we going to fit into this category? So you had a number of different opinions, and the reason that this classification was narrowed down from 3 to 2, I think it's really for two reasons. One is most people who murder only murder one person. Certainly, they may murder multiple people at one time, but they don't typically kill somebody and then go out and kill again. So that really puts people in a pretty unique category if they've murdered more than one person. There was also a practical consideration, though, and that was, is the FBI, we want to be invited in. We want to be accessible to law enforcement agencies who might want to do that. So if we narrow this definition down to 2, that's going to make it easier for us to get invited in.
Okay, that makes sense. Well, now that we kind of have an understanding, or that we do have an understanding of what a serial killer is, let's maybe talk about the traits. Are there common traits or maybe some red flags that would begin in the early stages of life for an individual, in like their childhood or their adolescence?
I think, we probably will have to do a little, breaking down of different kinds of serial killers, but we know a couple of different things. Certainly there
Okay.
is, it's so challenging because it'd be so great to say, okay, Jim, 98% of all serial killers are psychopaths. 98% or 100% of all killers torture animals when they're little. The reality is it's not true. So what we do know is that you're going to find that if you look at the general population and then you look at the population of serial killers, for example, you're going to find that more of the serial killer population exhibited these significant childhood behavior problems. They were more likely to torture animals, for example. They're certainly more likely to have had a traumatic childhood. A lot of them exhibited kind of what we call conduct problems as children. In adolescence, certainly the sexually motivated serial killers like Ted Bundy or John Wayne Gacy or some of the others we can talk about were more likely to develop these kind of fantasies where violence and sex were kind of fused or kind of blended together. So you see this kind of active fantasy life that starts from a relatively early age. So we can look at some things and say, yeah, these are some precursors or some kind of red flags, as you said, but that doesn't mean the majority necessarily experienced any of these. So, I'm often asked, okay, do most serial killers torture animals? No, the majority of them don't. And I certainly, in my work, I interview violent offenders every week. I know many, many, many violent offenders who would not only be horrified at the thought of hurting an animal, but they'd be the first in line to kill the person who did hurt the
Right.
animal. So yes, we can look at these, the fact that, we want to pay attention to those things because, for example, I know as a psychologist that if you have a child who's certainly over the age of, I would say 6, but certainly over the age of 10, who is deliberately harming an animal, that is a red flag, period. It isn't necessarily a red flag of a serial killer or a budding serial killer, but it is a red flag that something is not normal and that needs to be
Okay.
evaluated.
Okay. That makes complete sense. And it seems to me, just based off general observations, that most serial killers are male as opposed to being female. But I mean, there are female serial killers, correct? Okay. What are there, what would be the key differences in the motivations or the methods used by a male versus a female?
It's really interesting when you look at that. So first of all, you're absolutely right. The vast majority of serial killers are men, just like the vast majority of murderers, period, are men. I certainly know in law
Mm-hmm.
enforcement, you can attest to that for sure. And then when you
Correct.
look at, but there certainly are female serial killers. And actually, there's some evidence that that when you compare male murderers to female murderers, you have 90% to 10%. Statistically, that's kind
Huh.
of how
Okay.
it tends to break down. When you look at male serial killers to female serial killers, there's actually a few more female serial killers percentage wise in
Hmm.
comparison to this ratio of just male to female murderers. And actually, which I think is fascinating, around the turn of the century, not the 21st century, but the 20th century, and in the in the 1900s, and then all the way up to what you saw was that there was even more female serial killers in comparison to male serial killers. At one point, up to 35% of serial killers were females. Um, I could quiz you and say, why do you think that might be? And why do you think it's gone down? We don't know exactly, but the theory is that there were so many limited economic opportunities for women back then. They couldn't own
Oh,
land. They
okay.
couldn't work. They didn't have access to money. And we know that when you're looking at male serial killers to female serial killers in general, generalizing a little bit, are much more likely to have money as a motive, even today, than male serial killers. So the theory is that maybe as women became more economically, had more economic advantages, that you started seeing that percentage go down, which means that women's rights are good for men as well, at least in terms of being murdered,
Yeah.
potentially.
Yeah.
So when you look at this group, when you just asking about some of the similarities and differences, one of the biggest differences is that male serial killers tend to be more like hunters in their approach. They're more likely to go out. They're more likely to kill a stranger, to stalk, to do those kinds of things. Female serial killers are more likely to trap. So they're more
Hmm.
likely to lure their victims in. They're much more likely to kill people they know, and in particular, are much more likely to kill family members and people that are close to them. So
Wow, that
it's
is
not the hunters
interesting.
gatherers, it's the hunter trappers, when you think about serial killers.
Wow, that's an interesting way to explain it. That makes, again, that makes sense. I'm curious, once an individual takes that substantial step and they become a serial killer, can that individual stop at some point and never do it again? And if so, why would that be?
That is such a great topic of conversation. And, I think we could go all over the board with that. So we certainly know, can they not kill? Well, I've never known a serial killer to kill somebody when a cop is standing right next to them. So
That
obviously
makes
there's
sense.
some degree of restraint that
Hmm.
serial killers can always exhibit, right? They're not necessarily self-defeating or self-sabotaging or so out of control. Some serial killers do report that it becomes addictive. And I think there's some truth to that, but I'm not going to say all of them because we know that some serial killers have gone for 10 years, 15 years without killing anybody. We
Right.
know that some serial killers have stopped or kind of aged out as they got older. So we've had
Hmm.
some serial killers, such as the Golden State serial killer who, had murdered for, I don't know,
That
30 or 40 years.
I was trying to reference who you were, but that's exactly right. Yeah.
Yeah, Joseph James D'Angelo,
Okay.
was a former
Yes.
cop and he, had a horrific criminal career and yet, had kind of aged out of that. So, people can, yeah, serial killers can stop. Sometimes serial killers will find um, other ways of satisfying those urges or compulsions. I know BTK, Dennis Rader would sometimes dress up and reenact these crimes and do all kind of autoerotic asphyxiation and these kinds of things. When he was not serial killing, he stopped for a pretty long period of time. So and then other serial killers will say, well, hey, I was married, I had some kids, and I just, for whatever reason, during that period of time, it didn't have the same compulsion. So it really varies from serial killer to serial killer.
Okay. Yeah. That's kind of what I was going to surmise based off what you're saying here. And you beat me to the punch on BTK. It seems like that individual conducted his killings and then laid off for quite some time and then comes back to it. And so that is interesting, the description there on why individuals do that type of thing. And I completely understand it just varies from individual to individual, is what you're saying as well.
It does, and that's so frustrating. So it's like it was so interesting. It's like as a group, I feel like we understand serial killers to some extent as psychologists, but as an individual, that's the hard part, right? Predicting what one person will do is much more difficult in some respects than predicting what a group will do.
Right. Right. Is serial killing a problem or an issue specific to the United States, or is this an issue and problem across the globe?
It is primarily an issue for the United States. Now, there are serial killers in every country, and you could make the argument that one of the reasons why we lead every country, not just by twice, but by an amazing number, unfortunately, is partly because they get caught more often. So
Hmm.
there's some things that might complicate the statistics, but I don't think we can say that's really what it is. I think that we do, for whatever reason, in the United States, have a significantly larger number of serial killers, followed by the UK, followed by South Africa. I can't remember which one is two and three there, but those are kind of next in line. But you do find serial killers across countries. One of the things I think is interesting that your audience might have never considered, I certainly hadn't until I began doing some research on international serial killers, is looking at who the victims are across countries, because we often don't think about what does our culture have to do with serial killing. And yet, imagine being in a country where a serial killer killed 100 children before he was caught,
Hmm.
and killed dozens before anybody even noticed. I mean, we think of that and kind of go, that no, that's just not possible. It certainly would never happen in the United States. Serial killers, who do they target? Primarily sex workers,
Right.
people who are vulnerable in some way. Well, in certain countries like Pakistan, which is the one I'm thinking about now, they have a huge amount of poverty, a huge number of children who are forced by economic conditions to live on the street. They're out scrounging around. They're kind of called street children. And they have, unfortunately, because of their living situation, there's just a lot of petty crime that goes on, pickpocketing, and those kinds of things as a way to survive. And so there's a lot of prejudice against these children because that's the association. And this is who this serial killer was targeting. So I think it's interesting when we look across countries that who we define as vulnerable or who we
Okay.
define as not worthy of protecting in some respect is who serial killers tend to target.
Wow, that's an interesting issue. And again, I had not thought of it in that perspective. So yeah. How about it from the perspective of being in the shoes of the individual that is a serial killer? In their mind, do they know that they're evil or have psychological issues, or do they see themselves as normal or justified in what they're doing? Is that a fair question?
It is. And I think it's a question all of us ask and wonder about, because we look at somebody who's done such horrendous things and thinks, how could that person do that, first of all? And then, second of all, how could they justify it? What story do
Right,
they tell themselves, right? What story do you tell
right.
yourself that winds up with this? Um, so I think one of the things that I've found in the research I've done is that many serial killers, because they're all individuals when it comes at the end of the day, but many serial killers have an amazing ability, and I don't mean that as a compliment by any
Hmm.
means, to compartmentalize their lives. And so it's almost like a drawer, where I know BTK talked about cubing, where he could just flip this cube and be a different person depending upon what was going on.
Yeah,
But it's almost like they have these drawers and they put certain parts of their lives and they categorize their victims in a very different drawer than they might their family members or their parents or whoever. And so it's almost like they don't think about that to some extent in terms of when they're this other person, when they put it in that drawer, they're not thinking about it. So that's one thing. And you think, well, okay, that's true. There's an extreme example that we all have the ability to compartmentalize. I can imagine, Jim, I can't imagine being a police officer and being at a scene where you witnessed a child who's been murdered, for example, and then you have to go home and play with your child who's wants you to play with them.
right.
If you could not put those feelings and that experience, at least temporarily, in a drawer somewhere and then focus, how could you survive? How could you have a family? So we all have that ability to compartmentalize, but not to the extent that we would do something horrendous and then just kind of put it in a drawer. So, but I think that is part of that compartmentalization of kind of doing it over here. And then what is so interesting to me is that you have individuals who can do the most horrendous things, and yet they also feel a need to what we call neutralize what they've done. So, yes, they know they've done wrong. Yes, they know they've hurt somebody, but they find ways in the story they tell themselves that either blames the victim or minimizes what they've done or justifies it as somehow revenge. They find a story to tell themselves, or that their needs are more important. Nobody cares about this person anyway. They find ways to
Hmm.
justify and rationalize um, those actions to themselves in some way. And what's fascinating is even sometimes when you have this confession, somebody's confessing, even in the story they tell, you kind of think, why would they care at this point about justifying or minimizing? And yet, I'm sure you've come across this with people who've done horrible
Right.
things, and they're trying to somehow make it seem not so bad.
They're
And you're like,
rationalizing their
exactly,
action.
they're rationalizing it. So I
Yeah.
think it's that combination. But yeah, I think there's. I mean, I've never met a serial killer unless you're talking about somebody, which is very, very rare, who is a serial killer and they're psychotic. So for
Okay.
example, you had what's his name? Mullins, Henry Mullins, back in I think it was the 1970s, who developed this belief that unless he made a certain number of sacrifices, human sacrifices, the world was going to be destroyed in this horrendous earthquake. Now you kind of go, yeah, I might say that too if I'd been caught, murdering a certain number of people. But I
Right.
have a colleague who saw him a few years ago, and he still believes that. I mean, this was a genuine
Really?
delusion. Yeah, this was a genuine delusion that this person had, and he ended up, killing a number of individuals. So unless you have somebody who is in that kind of psychosis, which is very, very rare, um, they of course know that they're doing something wrong, that they're hurting other people. They just don't care.
Well, and you're kind of walking towards the next question I was going to ask, and again, realizing it varies from individual to individual, but do these killers ever, to your knowledge, feel remorse or express regret for their actions? It doesn't seem that I mean, and again, we're talking
Yeah.
in generalizations, right? But I've never read or heard of a serial killer being remorseful. I wish I wouldn't have done that.
Yeah, no, I agree with you, Jim. I really do. I think, I mean, I was trying to think as when I was researching for my book about serial killers, I really wondered that question and thought, has anybody turned themselves in? Because if you're
Yeah,
sorry that you did something, it's not just what you say, it's what you do. Um,
correct.
and there actually was a serial killer, his name is escaping me right this minute, but there was one serial killer I found who literally did walk into a police station, and he had killed several children, and he had um, kidnapped a couple of children. I think he might have killed one then, but there were two other, I think, if I'm remembering things correctly, I'm getting the basic facts right, but I may be missing a few or misinterpreting or misremembering a few facts, but he
Sure.
actually walked in and turned himself in, and there were a couple of kids that he had not murdered. And he just said, I cannot control this. I just cannot. He did feel bad. That's the only one I can recall that I've
Okay.
ever heard. And this is again somebody who's acted on those urges a number
Mhm.
of times before turning himself in.
Before
But you're
coming to
right. I
that
think that
conclusion,
that
yeah.
is like winning the lottery in terms of remorse. I mean, I think the vast majority, and that's so heartbreaking when you see families who are devastated by
Oh
the
yeah.
loss of their loved one. And and you have people who feel guilt that have no responsibility for anything other than loving the victim. And then you have a person who's done all these things who feels absolutely no remorse whatsoever. That's so
Yeah.
unfair. It's
Yeah.
hard to see that.
I would agree with that. And I think part of I don't know what you'd call it, problem or issue or the way it might be today is that people are so fascinated with the individual that's committing these crimes, they don't even take into consideration the victim of that crime, and they don't take into consideration the family and friends of the victim of that crime. Because I was reflecting back as you're talking about when I was younger and in the beginning stages of my law enforcement career, I found, serial killing and learning about that, the word fascinating, interesting. But as I got older and dealt with people more and saw victims of crime, it made me realize, you know, there's much more than just that serial killer. There's so much impact that those crimes commit. And I mentioned that. I hope I'm making sense, but I mentioned that in today's world and society, people are so fascinated with the killer and watching something on Netflix or Prime Video or something like that. I think folks need to take into account the victims and the victims' families as well.
I do too. And I agree with you. I mean, my interest, started early in terms of looking at serial killers and
Hmm.
understanding them. And I try really hard in my work to do a couple of things. Is to honor those victims and honor those family members, and also to focus on prevention. When I see, for example, a serial killer who had a horrendous childhood, and there are many who have been, I can certainly empathize with the fact with his child, not with this adult, with
Right,
this child. And I'm
right.
interested in this trauma, not as an excuse, but as how can I find other children who are experiencing this now? How can we as a society identify kids who are at risk of developing all kinds of issues and problems and prevent that development from this hurt child or traumatized child or whatever to becoming this person they become that hurt society and hurt innocent people and do all these things? Because you're
Wow.
right, it's a fine line in wanting to understand serial killers and understand what makes them, how they think, and how they plan things and how they evolved into who they are, and it not glorifying that, or not, making them be some. I always kind of cringe when somebody goes, this is a monster. It's like, no, when you say it's a monster, it's a person who's doing bad things. It's a person
Yes,
who's stacking the deck in their favor. It's basically a person who's a coward, right? I mean, how many serial killers do you know who've wanted some kind of an even contest? No. They
right,
pick people who are weaker than that are more vulnerable than they are. They make sure every possible advantage that they have. I mean, how does that take any kind of courage, or what is exciting or sexy about that?
right. You're exactly right. Yeah, I agree with that wholeheartedly. But kind of, what, how does forensic psychology play a role in not only identifying serial killers, but helping law enforcement stop the serial killer? Is that a fair question? As a forensic psychologist, what role are you playing in identifying individuals out there? And how are you helping law enforcement stop that serial killer mentality or behavior?
Yeah, that's I think a really good question. I think as forensic psychologists, we are much better at helping. I think we can look at behavior patterns. I think we are learning. There's been more research, at least in forensic psychology, away from profiling and looking more at behavioral analysis, more at patterns of behavior. So looking at crime scenes, for example, and trying to figure out what does this mean behaviorally about this person. How can we help law enforcement understand that when we've done this research on serial killers, and this kind of serial killer is more likely to move the body, or this serial killer is more likely to bind the victim. I think we're also becoming better, and this is research based more than anything else when you're talking
Sure.
about doing that kind of, because as we can maybe help say, okay, we can help maybe narrow down suspects to some extent, or at least say, this is what we think of the suspect pool that you have. We're never going to be able, at least in my lifetime, I think, be able to kind of go, this is the person you're looking for right here. We can
Right.
help narrow that down. I mean, law enforcement, that's their job, is
Right.
to, right, to find the evidence and put all those pieces together. But I think we are starting to do some research and identifying what kind of serial killer this person might be, and what that might say about that person's life, what that might say about that person's zone of operation, what that might say about that person's occupation, or those kinds of things. What does it mean if this person, I think we're also becoming much more aware of the fact that some of the assumptions we had for a while are just not true. We know that this signature that many serial killers exhibit, this kind of psychological stamp that they put on a crime, tends to be consistent right across time.
Right.
But the MO can change drastically. And I think for a while it was like, no, we were thinking, okay, if the person, strangles this person to death and they wrap them in burlap, this is probably bringing a relatively recently accused serial killer to mind, the
Hmm.
Long Island
Yeah.
accused Rex Heuermann. If they put this person in burlap, they're always going to put the person in burlap, or they're always going to, it's like, no, they may not, you may bind a person or cover their mouth and restrain them one time. Well, you may not have to restrain their mouth the next time because you're out in the country where nobody can hear them. So
Uh,
helping sort out some of the MO part of it from the signature. I mean, those kinds of things I think we can help. And then I think we can also help in terms of from a prevention standpoint, which is not necessarily a law enforcement issue, but is more from a societal issue, looking at some of the histories and how the points we can intervene.
yes. That makes complete sense. You're essentially giving law enforcement pointers in the direction to look and what to be looking for. So it's a fantastic working relationship. And you mentioned, something that I was thinking about in preparation for today is, I'm 55 years old, and it's for as long as I can remember, there have always been serial killers that you always hear about, from Ted Bundy in the 70s, the prolific killings that he conducted, to who you just mentioned, that Rex, and I can never pronounce his name right, Rex Heuermann in Long Island. I'm just going to refer to him as Rex. But he was arrested in July of 2023. So that is very recent. So my point is, serial killers exist in our society and have been, for quite some time, and they continue to do so. And it's just so important for not only individuals like yourself, that study and analyze these type of people, but for law enforcement to continue their efforts on this. And I would even take it a step further and say it's important for the public to be informed and aware to kind of watch for this type of behavior. So I'm kind of getting off on a little soapbox there, but I think it was important to mention that because your mentioning of the Long Island, those Gilgo Beach murders kind of made me think of that. So I apologize for kind of straying off a little bit here. This episode of the Right to Remain Silent True Crime Podcast is sponsored by Graphic Options. When it comes to custom screen printing, embroidery, and promotional gear, Brenda and her team are the real deal. I trust them with everything, whether it's a hat for my consulting business, a shirt for my podcast, or a large order of both. They've never let me down. They don't treat you like just another order. They listen, they care, and they make sure you walk away with something you're proud to put your name on. You have the right to great service and quality, and that's exactly what you'll get at Graphic Options. Visit graphicoptionsonline.com. That's graphicoptionsonline.com, and let them know the Right to Remain Silent podcast sent you.
No, I think I'm so glad that you mentioned that because I've done a lot of thinking about true crime and what that means for everybody. What does that mean for victims' families? What does that mean for law enforcement who has to deal with a public that has different expectations of them, perhaps, or the media? And I would be the first person to say that it's a mixed bag. I mean, I think we have to be ethical in how we talk about true crime and we have to be respectful of victims'
Right?
families and also of perpetrators' families who oftentimes are innocent as well. So there's a certain level of
Correct.
sensitivity. I also think, as you pointed out, though, that one of the benefits that I've seen of this kind of increased interest in true crime is I do think we see everyday people, citizens, becoming more interested in helping and being more willing to speak up and look through their videos. And we've had, several cases that were either solved partially or gave amazing links because they had a video or they saw something and I think that's a positive thing that people are more aware of things that happen. And I think they're more personally invested in being part of that kind of crime solving community.
Yeah. Yeah, you're 100% right. And I agree with that. Well, how about we kind of transition a little bit to more notable serial killers or higher profile ones, and we've kind of mentioned a couple of them throughout our conversation here. There's the Jeffrey Dahmers, the Ted Bundys, the BTK. One that I've found kind of interesting is, and again, I'll probably pronounce the name wrong, but the Eileen Wuornos, the female
Mhm.
serial killer down in, I think it was Texas. And then one that I found fascinating, simply because of some work that I did in my career in law enforcement, was an individual named Angel Resendez. They refer to him as the railroad killer in the 80s and all through late 80s and all through the 90s, where that individual would travel the railroads and jump off in various states and kill people. So there's some very notable individuals out there. Is there any one or two that you're particularly familiar with that, we could discuss and maybe talk about, their background and their thought process and their killings?
Wow, there's several of them that you
There's so
bring up.
many,
Yeah, there are, unfortunately, a lot that,
and maybe
although it's
not even
interesting, like
one.
you pointed out the ones that were, I think we know the most. Richard Ramirez would be the other one, the Night
Yes,
Stalker.
yes, yes.
Um, I mean, I think that I could probably talk. I can't say that I could, relate every aspect of that person's
Right. No, no,
background.
I'm certainly
Um,
not asking that, but just generalizations about, how they started and the thought process and motivations of generalizations about this an individual that's a high profile serial killer. Would that be a fair question?
One person, Richard Ramirez, does come to mind for me, I think, because he really had a pretty horrendous background, in terms of just exposure to sexual activity, in terms of, witnessing his cousin shoot his wife in the face,
Hmm.
when he was young. I mean, it was almost like you look at his background and you think if anybody was groomed to be a serial killer, it was him to some extent. He had there were, I think, five siblings in his family, and they lived in Texas. And there was just a number of just really, really horrendous things that happened to him,
Yeah,
as a child, and that's not uncommon. It isn't. On the
sure.
other hand, you look at Ted Bundy, and you kind of go, okay, we all have hard things in our background. Every one of us can say, "Wow, this happened to me when I was a child," and I think about it, or I remember that. His mom, is like, you may be familiar with some of this stuff, so just jump in here, Jim, and
No, please share. Yeah, we'll
add
do.
your biography tidbits to it
Sure.
as well. But I
Yeah.
remember with Ted Bundy, he was raised with his grandparents as his parents, or his, yeah, and so
Oh,
he
that's
he
right.
believed, yeah, he believed that his mom was his sister for a number of years, and then found that out, I think, when he was a teenager. I can't remember exactly how he found that out, but that was
Hmm.
something that really left a mark on him. It seemed like his grandparents cared about him, that he had a relationship with his mom. That was a huge shock for him. His mom did remarry and had other children. I think he did probably feel left out, or like he was an odd person out, because, his, I don't know very much about his biological father, but I don't think he was ever in his life. And so being raised as the oldest child, but he's got these half siblings, and he finds out his mom, who he does eventually go live with. So I think that had an impact on him. But I think anybody who's hearing our conversation is going to kind of go, yeah, that's not a great
Right.
experience to
Do you
think that you're,
think,
but is that something that's going to cause somebody to, to,
right, right,
no, we can't connect the dots there, right?
right,
There's other factors that come into play there. I mean, this is somebody he was intelligent, he was not bad
right.
looking, he was in law school at one point, he had a long-term girlfriend. I mean, this is not somebody who
He
spent his
looks,
whole life being bullied, and, nobody cared about him, and, things that you think, man, this would be traumatic. And so how do we explain this person? Anne Rule met him when he was volunteering on a crisis unit, I mean, a suicide hotline. I
hmm
mean, which is
right.
frightening when you think about it.
And when you think about this guy, and I had really kind of forgotten the number of people that he murdered, again, preparing for today. He was believed to have murdered 30 women, is my understanding, and possibly more that they could never, fully proved. So that is a substantial amount of individuals when you think about it, because my understanding, the time frame that Bundy operated was 1974 to 1978, and murdering at least 30 people in that time frame, that is substantial. And what is so shocking to me, and I've thought about this through my entire probably adulthood and law enforcement career, is you never know where these people are. They could be within your community. They could be shopping at the same grocery store. Think about this. I've thought about this. Everybody gets fuel for their vehicle. Everybody buys gasoline. You go to the gas station. How about grabbing that pump handle and putting that into your car and filling your car full of fuel? Has a serial killer done the same thing with that exact same pump handle at the exact same gas station that you use? That's how prolific and I don't know what the right word would be, how what a great possibility it is that these individuals are out there, like Ted Bundy, like Dennis Rader. It's just shocking when you think about it.
It really is. And not just the fact that the number of people when I think about Ted Bundy, but I'll never forget one of his victims. He used to just do these things that are just so sadistic, in my opinion. In other words, he would, be on crutches and ask somebody to help him, or have a cast on his arm and ask somebody in the middle of the day. One of his victims was in the middle of the day at a lake. There's, dozens of people around, and he's got this, cast on his arm, and he's got books and he can't carry them. And he asked this woman, young woman, if she would help him carry his books to the car in the middle of the day at the lake. And he says yes. She hesitates, and then she's like, she's a nice person. She's just the
Right,
person we would want our daughter to be, right? That we want somebody who is helpful and caring, and she's out, it's sun shining. I mean, what's to worry about? It's
right,
right there in the parking lot. It's not like he's, she's going anywhere, but that would be scary. And to think that he would use and prey on someone's kindness in that way is just, I don't know, is so hard for me to wrap my head
right.
around. The
It
very
just,
the very thing we value in people, which is that kindness and willingness to help other people, is being used to capture them and then do all kinds of horrendous things.
yeah, that is a great point, and that just brings the point home that evil is out there. Evil is in our societies. It's in our towns, and this probably could be a whole nother topic of conversation here, but I will mention, I have young children, teenagers, and being a law enforcement officer my entire career, I've seen things that are cause for concern, and I constantly harp to them about it's a fine line that you walk about raising your child to be polite, to be respectful, to do the right thing, but yet not put yourself in a situation like you just described, where an individual uses that against them and they ultimately become a victim. So that's a fine line that all
It
parents
really is.
probably have to walk in raising their children appropriately.
It really is. I mean, I struggle with that. I have four kids, and I have two girls that have now finished college. But I mean, I look back and I'm thinking, I used to send my college freshman daughter, just the most odd things in some respects. For example, this fingernail polish you could wear that you could put in your drink, and it would turn a certain color if your drink had been tampered with. I mean, just, it's like,
Hmm.
it's a wonder that she's a normal adjusted child at this point. But you're right. It was just that sense of like, you want your children to be loving and care. I grew up in the South where, being polite, being helpful was just instilled in me from such an early age, to just,
Right,
again, to be polite and helpful and those kinds of things. And trying to find that balance, as you said, that balance between, being a nice person and somebody who cares about other people, and yet at the same time realizing it doesn't feel that way. Everybody doesn't have the same values that I do or you do, and so, you know, being sure to put in place some safeguards that's going to help
correct,
you um, stay as safe as
correct.
possible, and at the same time not lose your faith in the world. It's a balancing act for
Right.
parents.
Right, you're right. You're right, and it's unfortunate, but it's just reality. So, yeah. Yeah, great point. I agree. We've talked generalizations. What's a serial killer? Traits of a serial killer. We've talked about high profile serial killers. How about would you would you be comfortable sharing an experience or two that you personally had through the course of your work with interacting with serial killers or individuals like this, in this realm?
I can talk in generalities, I guess.
Sure, but not
In terms,
specifics and names but just kind of
yeah,
generalizations
yeah.
about what you've
So
seen and
so it's interesting. When I worked in a maximum security prison for a couple of years, which is an experience I will never forget and be eternally grateful for, because it really allowed me to be on the inside in some respects in terms of seeing just the interactions every day, getting to know people in a different way. And so I mentioned that because when I was working inside of a prison, I had the most exposure to people who had done all kinds of different things, and a lot of murder and those kinds of, and a couple of individuals who had, I'll just say, been committed of more than one murder. So,
Mhm.
um, but yet, when you're working in that environment, you're not, oftentimes don't know that person's crimes. That's not a concern. What's a concern is that person's functioning on a day-to-day basis. So sometimes I found out what that person had done after I had interviewed them or worked with them or gotten them transferred from one yard to the other. And so I'm kind of speaking really after the fact, because again, you're really not supposed to know what people are in there for. The
Sure.
other inmates aren't supposed to know, right, what other
Right.
inmates are in there for. So that's very, very confidential information. But I can remember two individuals in particular that I found out later on would meet our definition, I guess is the best way to put it. And I guess what was interesting is they were both so incredibly different. Um,
Hmm.
one and you do see sometimes, not very often because they tend to get caught quicker, but this one individual I'm thinking about, and what stood out for him for me, I think, was the fact that he just, when you're talking about like, this compulsion or this impulse control, it wasn't so much like this is somebody I felt like he was addicted to what had done, but more like he had absolutely no impulse control whatsoever. None. I mean, it was like, I think that there was maybe some intellectual limitations there, but it just, I rarely met anybody who had that degree of just a lack of impulsivity. I mean, he just could not, if he got angry, for example. I mean, he was getting in trouble all the time because you could tell him, this is not your best interest, right? If this custody officer is not being nice to you, you're not on a level playing field, right? I mean, you are going to
Right.
lose in this situation. I mean, just practically speaking. And what was interesting is when I looked later on, I had the chance to review his file. The murders he had committed were very much like that. In other words, he was with somebody I think it was a sex worker that he had been with, and she said something that made him mad. I
And
don't know
he
what it
just
was.
reacted.
Yeah, and I saw that it was just interesting to see that because, like I said, he was always in what I call, what everybody called the hole, or
Right.
in segregation. Because I don't know how he made it as long as he did, because it just, this lack of control when he got mad, not all the time, but anything made him mad. It was just like he just could. And the other person that I'm thinking about was the exact opposite of that, meaning, in, working in this environment, I would say less than 1% ever remembered my name because they're focusing on
Okay.
surviving. They know I'm a psychologist. They like psychologists in general because we can help them. We can either help them with therapy, we can help them get off the yard if there's a drug debt, because they can say they're suicidal. There's lots of things psychologists can do
Right.
for you
Right.
when you're in prison. Hey, but you're a psychologist. If you're a psychologist, you're like in a category, but nobody's going to say, "Hi, Dr. Johnston, how are you this morning?" Like, that's just not how things work there. And this one guy stood out for that reason. He knew everybody's name. He knew every psychologist's name. He knew every psychiatrist's name. And he was so incredibly skilled at manipulating, um, not only other inmates, he would sometimes find these ways to kind of poke at them and get them, one mad at the other. But he was very skilled in, I can't remember if he actually would classify as he was a serial offender for sure. I can't remember if he was
Okay.
a serial murderer, but he was definitely but again, it was interesting because his crimes kind of matched that. They were very well planned, well thought out, very organized. And so it was fascinating to see that being reflected. But it really stood out because even though I was very surprised when I saw him again after I first met him that he remembered my name. And yet something about him I was very uncomfortable with. It was like that primitive part of ourselves that says,
Right.
this is a shiny object that's not shiny on the inside, kind of
There's
as a
something
person.
up with this.
Yeah. Hmm.
Yeah. Wow. Those are two such differing examples, but yet both creepy. You know, for the reasons you explained. One individual that just flies off the handle and does whatever they feel like doing, and
Hmm.
another one that's cold, calculated, and manipulative. So yeah, that just shows the wide-ranging variety of individuals out there that kind of fall under the serial killer category.
And I think that probably mirrors some of the stuff that you heard early on in your career. I have too, which is the kind of the organized versus disorganized, serial
Yes, yeah,
killer.
yeah,
We now know that that classification is not all that useful, I think, now because most, even disorganized serial killers are organized to some extent, or they wouldn't
right.
be able to pull off their crimes. So it's kind of a continuum more than this dichotomy. But we do still see some patterns, with this kind of organized versus and what I just said to you, I think in some respects is these extreme, almost extreme examples of that.
Yeah, yeah. Well said. How about just a couple of general questions about this topic? Are serial killers becoming more common, or are they just more reported? You, I think we essentially touched on that, but what are your thoughts on that?
Well, it's interesting because I think when you look at the literature today, I mean, what I read over and over again is that, we don't have serial killers anymore, or hardly any serial killers anymore. People talk about the heyday of serial killers, which was the,
Right.
70s and especially the 80s and the 90s, and we're catching them sooner. And I think we have probably seen a decrease and in serial killers numbers wise. I think that we are getting better at catching wannabe serial killers maybe the first time after they offend. um, and I also think, of course, there's always the wild card, which is, are we catching the really good ones? We don't know how many are out there that are not being caught.
Yeah,
And that's a scary thing. Now,
that's so true.
I do think the biggest gift, and I know you would probably agree with me here, the biggest gift has been DNA and genetic genealogy and
Oh,
some of the things that is just a
100%.
game changer. So
Yeah.
I think that the power has shifted, if it's ever been, tilted toward offenders. I think we're seeing a definite shift there. So I think that's encouraging to see.
Yeah. Okay. How about this? We've talked about traits, we've talked about remorse or lack thereof, but once an individual commits these crimes and is categorized as a serial killer, can they be rehabilitated, or is it not possible? Are they beyond the point of return? Is that a fair question?
I mean, I think all questions are fair. First of all,
Hmm.
I
Hmm.
think the question is, if we assume, and I do as a psychologist, that the first part the first necessity of rehabilitation is motivation. That person has to be motivated, right,
Correct.
to be rehabilitated.
Yeah,
If I have no remorse or no regret, where's the motivation or the incentive to be
that's so
rehabilitated? What
true.
does that
Yeah,
what does that mean?
yeah.
So, are there serial killers who perhaps could be released into society that would never reoffend? Potentially. Would that be because they've aged out or some other
There,
factor, or would
yeah, I
that be
guess there
because they're
could be different
rehabilitated?
factors.
That's a hard one. I don't know.
Yeah.
So
Yeah.
I don't think that our standard concept of rehabilitation applies oftentimes when you're talking about serial killers.
Sure. Okay. How about this? Is what's the most important lesson that you've learned during your career as a forensic psychologist dealing with these types of individuals, or maybe not necessarily serial killers, but serial offenders? Is there one kind of more prominent than any others, like lesson that you've learned about dealing with these individuals?
That's a hard one. I'm just trying to think. What's the most important thing I've learned?
I would guess, and as I thought about asking that question, you've essentially answered it, I think, in our entire conversation, is that people are different and scenarios are different. Um, so if somebody posed that question to me, perhaps that would be my response. I know it is a tough question, but I was just kind of curious.
I think, yeah, I definitely think people are different.
Yeah.
I do. And I also think, I also have some other, I do not think that serial killers are born.
Okay.
That's a
Okay.
question that
That's
I've
a
gotten
great, yeah.
oftentimes,
Yeah.
about nature versus nurture. I think that you can find kind of arguments for percentages that vary across that spectrum,
Yeah.
but I've never seen somebody that I thought this person was just born this way, and that's how they're going to be. I think
That's a
there's
great
always some
point.
interaction between those two. And then when you're talking about like we're all individuals, I think that's definitely true. But I also think that it's almost like there's a pieces of a pie when you're talking about a serial killer. And we have pieces of that pie that we know about, like traumatic childhood, like certain personality traits, like certain temperaments. I mean, certain life experiences,
Hmm.
certain family backgrounds and those kinds of things. What we don't, I think, have a handle on completely yet is how those pieces fit together and the fact that they probably fit together differently for each person. But those are probably some
Yeah.
common pieces, right? You
Yeah.
find some of the same pieces in that pie.
Yeah. That makes complete sense. Well, how about this? You've done this, had a successful career doing this. How about somebody younger that's starting to consider getting out into the workforce, into the work world, and they have an interest in psychology or forensic psychology? Would you have any, based off your experiences and your career, would you have any advice to offer an individual that's interested in pursuing this type of career?
I would. I mean, when I was in school, this will show how long ago it was. There was no forensic psychology programs per se. I mean, there were psychology programs, but if you wanted to be a forensic psychologist, you had to try to go and get some, take some extra classes or find a way to get experience. That is not at all
Right.
true today. I mean, now there are some clear paths of, you can get a PhD in forensic psychology. So I think in some respects, it's a lot easier than it used to be. You can kind of identify that. Then the question becomes, how do you get experience? And I think there are some great internships. I also think there's some opportunities such as volunteering for crisis lines or such as volunteering for cold case foundations. I think there are also some more, opportunities from a, kind of volunteer wise that we didn't used to have, or at least I wasn't aware of. So I think
Yeah.
there's some more opportunities. I think people have it's become an area of great interest, I think, for
Yeah.
students. I'm sure you come across this as well,
Yes.
where I felt like kind of like a freak, honestly, when I was in college, because I literally twisted one of my professor's arms, almost literally, but not really. But I begged, I'll put it that way. And
Yeah.
he ended up taking our class to a maximum security prison over the summer, when I was taking the class.
Oh,
And
wow.
people were kind of interested in it, but they were like going along because I was so interested in it. So I think there's a lot more opportunity today to to kind of study those things or volunteer and learn more about those things.
Yeah, that is a fantastic point. Take advantage of those opportunities out there. So great advice. Well, let's talk about you for a little bit. You've written a number of books. Could you share some details about your books? I know Serial Killers, 101 Questions True Crime Fans Ask People, but you have some others as well. Could you talk about those?
Yeah, I think the first book, well, I've written a couple of different books, as you mentioned, before I became, just doing forensic psychology full time. I wrote The Complete Idiot's Guide to Psychology, which was really one of the most fun books I ever did because it was trying to figure out or how to explain psychological research in
Yeah,
a way that everybody could understand, which is something that I have such an interest in, obviously, doing
correct.
media stuff today. So that was really a fun book. My agent came to me at the time and said, Joni, you have so many interests. This is the book for you.
Yeah,
It's about psychology. So
yeah,
it was a really great opportunity. I love doing it. I revised it for a few years. I also wrote The Complete Idiot's Guide to Understanding Anxiety. That's something I've had personal experience with in the past. So I was very interested in and being up to date on the research and talking about that again and talking to lay people or people who might be suffering from that because I could certainly relate to that. So, and then of course the most recent one, the serial killer book,
yeah.
was really fun to do. I'm trying to think how I write a blog for Psychology Today, and so those questions came about as a result of me for the past 15 years writing this blog for Psychology Today. So it was really fun to try to think all the questions that people had asked me and to just keep a list of them. And so when COVID was going on, we were all trying to figure out how to survive that. That's how I
Yeah.
did it. It was just really go back through and list those out and try to make sure I knew the answers and those kinds of things. So that was also a super fun
That's a
book to write.
great concept. That's a great, that's going to be moved to the top of my book order list. That's a great concept. Well, I'm assuming, but I want to ask, people can find your books on Amazon or Barnes and Noble, or I know you've got a fantastic website as well. Can they get your books there or find out more about your books on your website?
They're definitely available on Amazon and Barnes and Nobles. And then, yeah, they're on my website, which is drjonijohnston.com. Pretty easy, right?
Yeah, absolutely.
And I also do a Substack newsletter, which is really a fun. Try to keep up with the research in that way. And it's called The Mind Detective. So that's might be something that
Okay.
people are interested. It's a completely free newsletter, and it kind of helps me keep up with what's going on currently and
Okay.
write about it. So I'm getting some good feedback about that. And it's fun. It kind of keeps me feeling like I'm trying to be sharp and, stay up to
Yeah.
date and understand what's going on and any of the new research, how can we apply that and those kinds of things. So I
It's
feel
called The Mind
the
Detectives.
mind detective on
Oh,
Substack.
okay. Outstanding. And correct me if I'm wrong, you have a YouTube podcast as well?
I do a
Unmasking
YouTube
a
channel
Murderer?
called Unmasking a Murderer,
Yeah.
which I have to say, I always cringe when I say that just because I've been so involved in doing other media stuff that I am not paying as much attention and taking such as much care of my own YouTube channel.
Oh, you can get pulled in so many directions that it's hard to focus on one
It
thing.
is. It is. And I need to do a better job with that. But it's a good problem to have. You have
Yes.
an opportunity to, to talk to different people and those kinds of things. So I'm not complaining. I feel very lucky
Yeah.
about it, but can stretch myself a little bit too far sometimes.
Yeah. Yeah. Well, do you have, before we finish up today, any final comments? Is there anything we should circle back and touch on before we conclude today?
Well, first of all, it was an absolute delight to meet
Oh,
you,
same here.
as I knew it would be. So I'm super happy about that.
Well,
And
thank you.
I love the idea that different disciplines are just starting to really work together and collaborate. And so that's just one of many reasons, Jim, I was so happy that you invited me to come on today because I have so much respect for what you do and what you've done. And I do think that working together and having different disciplines work together and listen to each other and collaborate, I think we all benefit from that.
Oh,
So
I wholeheartedly agree. I'll echo your sentiment there. Absolutely. Well, I thank you and I appreciate you for sharing your work experience, your knowledge about a very interesting topic today. So thank you again.
Thank you. Again, I look
All right.
forward to keeping up with you and,
I'm sure there's many more topics that maybe we could touch on in the future. And maybe I could talk you into coming back as a guest sometime in the future.
done. Absolutely, Jim.
Deal. All
Anytime,
right.
just let
Deal.
me know.
Deal. Absolutely. All right. Well, thank you. And let me finish up by saying to my listeners, again, I'd like to ask you to please follow my social medias. Please like, share, subscribe, and follow. And that helps me bring you great guests like Dr. Joni Johnston. So thank you to my listeners as well. And everybody stay safe out there. The Right to Remain Silent podcast is brought to you by Streetwise 360 Studios. I would like to again thank today's guest for sharing the story right here on the podcast. Please remember to like, follow, share, and recommend us so that I can continue to bring you high caliber guests sharing their experiences just like we heard today. If your law enforcement agency is interested in training provided by Streetwise 360, or if you know someone that has an interesting law enforcement story to share, please contact me via the website, www.streetwise-360.com, www.streetwise-360.com.